If you're anything like me, like learning anatomy through sports injuries, this episode 27, sponsored by you. Yes, you, sponsored by you. Drop a like, share it, comment, whatever. Joe Theismann, November 18th, 1985. But at the time, most shocking injury of all time. So Joe Theismann, quarterback of the Redskins against the Giants, most cooked video. It's a flea flicker, and he's going to get sacked. Now, ABC has this revolutionary reverse angle that they showed, okay? So Joe avoids one tackle. This guy flies in the air. All of his weight lands on Joe's lower leg. I have a little bit better video here. It's quick, though. So he lands on that lower leg, and it's bent a way that it should not be bent. So Joe Theismann, what happened? He had a lower leg tibia fibula compound fracture. It was a spiral fracture. We've talked about this once before in baseball, but spiral fracture basically is when Joe was twisting one way and the force was going down another way. So it caused a spiral fracture, and that's exactly what happened. So the nerves that are involved in this, you want to check the common peroneal nerve, also known as the fibular nerve. We talked about this because they're the same thing, but two different names just to make it impossibly hard. That would result in foot drop and a sensory loss on the bottom or the top of your foot, the dorsal part of your foot. The sural nerve as well is lateral foot sensory. It doesn't have any motor function, but you want to check these in a situation like this. And a danger for an injury like this would be compartment syndrome. We've talked about that as well. Luckily, Joe did not have compartment syndrome, but we're going to find out he did have a complication after all. So what did they do? On the field, they gave him a leg splint as well as a quick evaluation to check for sensory and blood flow, and then they transported him to the hospital. In the hospital, they would do x-rays, give him antibiotics because a compound fracture, as we know, is highly likely to get infected, and then they would do a surgery, whether it was a external fixation or an internal fixation. It wasn't very well documented of what they did. However, they did have to do 2 surgeries, which involved cleaning and alignment. And so he was estimated to return in about 3 to 6 months. And he was actually very optimistic about returning to football after that time. However, the complication was when he was recovering, the outer bone healed as it was supposed to, but the inner bone did not, and it was insufficient. Now, the reason this is, the outer bone is called cortical bone, and that's the hard part of the bone that you can like knock on yourself and you feel that it's hard. Inside of your bone, it's actually kind of squishy and sponge-like. It's like a honeycomb, and that's because it's like that to transfer forces, right? So if it's a honeycomb, the forces transfer evenly throughout the bone, and if it was just completely solid, it wouldn't transfer well, and that's why our bones are like that. So that inner part of his bone did not heal correctly. So that resulted in a leg length discrepancy, which means one leg was shorter than the other. And of course, if you're a quarterback in the NFL, you probably need both legs to be the same length. And he could have wore like a sole insert that increased the length of that foot a little bit, but in the NFL, that wouldn't have worked. So he failed the physical and was released by the Redskins and wasn't picked up or signed off of waivers, and he thus retired in 1986. So that's Joe Theismann.